name is Linda Southward, and I have the honor of serving as the Executive Director of the Children's Foundation of Mississippi. We at the Children's Foundation believe that for Mississippi to reach its potential, we must make sure that our children reach theirs. One of the ways that the Children's Foundation elevates important and timely topics impacting Mississippi's children and their families is through our Chat About Children series. Today, we cannot think of a more timely topic than the impact that COVID is having upon children all across Mississippi. Today, we welcome the opportunity to talk with Dr. Mary Taylor, Chair of Pediatrics, University of Mississippi Medical Center. First, a little about Dr. Taylor. She is a native Mississippian. She attended Southern Methodist University and graduated from UMMC Medical School in 1991. She completed pediatric residencies and then 2 fellowships, pediatric cardiology and pediatric critical care at Vanderbilt University Medical Center. She also completed a Master of Science in Clinical Investigation at Vanderbilt. In addition, she completed a visiting clinical fellowship at Boston Children's Hospital and helped create a pediatric cardiac critical care unit at Vanderbilt's Children's Hospital while on staff for 10 years. And then about 10 years ago in 2011, Dr. Taylor joined the faculty of UMMC to co-direct the congenital heart program and to build a pediatric cardiac intensive care unit at Batson's Children's Hospital. She was the division chair of both pediatric critical care and pediatric cardiology prior to becoming named chair of pediatrics in 2017. And as leader in the Department of Pediatrics, she's been a key member in the strategic planning of a $180 million expansion of Batson's Children's Hospital. Among national peers, she's been a member of the Pediatric Cardiac Intensive Care Society since its inception and continues to serve as a board liaison for critical care. How fortunate for the state of Mississippi for our children to have Dr. Taylor at the helm of the Department of Pediatrics at Children's of Mississippi. So, welcome. Earlier this week, the Children's Foundation released a brief on children and COVID-19, highlighting the dramatic increase in hospitalizations of children. Today, we want to explore what the current situation is on pediatric COVID cases, particularly hospitalizations, how it's changing, the implications for children. And then we also really want to know what can the public do to help lower the number of COVID cases in children. So we've had people submit questions and Dr. Taylor, let's go ahead and get started. First, to tell us a little bit more about the hospital. We hear that UMMC is the only level 1 hospital in Mississippi, and also we know that it's the state's only children's hospital. Tell us a little bit more about these distinctions and why this is particularly important to know in terms of COVID in children.
Yeah, so thank you for that great introduction. The Children's Hospital is the only children's hospital in this state. There are some hospitals around the state that have some patients in the hospital, in the community hospital there, but certainly if children have to stay in the hospital for any length of time or have anything of any complexity, they get sent here to our hospital in Jackson. We want to be the hospital for the entire state of Mississippi. So our vision and mission include touching the life of every child in the state of Mississippi and helping them reach their full potential. So that kind of struck me when you mentioned that in the beginning. We have the same goals in mind. Particularly around COVID, being the only children's hospital, this surge in pediatric cases has really put a burden on the system, because children continue to get the other things that children have and have the summertime illnesses and those types of things. And unusually, we also have a surge in other respiratory viral problems right now, which is kind of a little unseasonable increase in respiratory syncytial virus or RSV, rhinovirus, enterovirus, other kind of viruses that typically don't come around until November, December, and, they're right now. So, with that in mind, our hospital is having to take patients from all over the state that are critically ill, some of them that are just ill enough to be in the hospital and need more intensive management they can have at home. And so that our transport systems are impacted, our hospitalization numbers are impacted, our emergency room visits, all of those things. I think COVID has really put a strain on our systems in general. The unusual part right now is this Delta variant. I think, back in January, we had a surge, and children really didn't see the impact of that at that time. We had at the most maybe 3 to 5 patients in the hospital at any given time, and maybe 1 or 2 in the intensive care unit, and none of them particularly sick. We had patients that were in the hospital for 3 or 4 days, more like a typical viral kind of cold type illness, and then go home. So the bulk of the illness was really on the adult hospital, and the impact of COVID on the first big wave in January was in the adult hospital. And actually our numbers in the emergency room were quite low at the time because people were avoiding coming to the hospital. Our outpatient pediatrics numbers were quite low. With this Delta variant, however, we've had a huge surge in pediatric cases. So we've had anywhere from 15 to 25 patients in the hospital at any given time. So, 5 times what we had back in January. We've had anywhere from 5 to 8 patients in the intensive care unit at any time. We've had multiple patients on the ventilator, which is pretty significant. So we've had some really serious illnesses with this virus this time, and not necessarily always in children with other problems. The first go round is more focused on children who've had chronic medical conditions or things like that. These are otherwise healthy kids. Some of them do have some overlying obesity or that type of thing, but for the most part, they're otherwise healthy children who are being impacted by the Delta variant.
So that puts it really in perspective when you talked about January of this year to August of this year. And if I understood you correctly, you were saying 5 times the number of the little ones, of children who are in the hospital in ICU and other areas.
That's right. That's right. Back in January, we had 1 or 2, and now we have 5 to 7 in the hospital. I mean, in the ICU. And
So with the children who are in ICU, what about children who have COVID but are in a regular bed? That obviously has increased as well.
Right. We've had many in the ICU, but we've also had many in the regular hospital. So today, I believe there were, I want to say 15 or so in the hospital altogether. We've had more than 20 at a time in the hospital, which is quite a few patients. We've had them on every floor of our hospital. We've had them in various stages of illness. Some of them getting, deteriorating and needing to be transferred to the ICU. We've had quite a few waiting in the emergency room at any given time because our numbers are so high that we've had patients boarding in our emergency room waiting for a bed. So that whole backlog of patients, because sometimes they might have RSV or other respiratory viral illnesses on top of having COVID. And again, we still have the regular things that children get, especially now that school is back in session. We have other things that are coming in, kids getting sick from other reasons. So, we want to be available to children, of course, at all times. And this is kind of straining our systems to be able to provide the level of care that we need to provide.
So you have given us a glimpse of what it's like, the numbers of patients coming in. Once they're inside the hospital, we hear numbers, we listen to the reports, but and you're also beginning to touch on it, on the strain that this is causing within the hospital. And so I really wonder about one of the things I was going to ask a little later, but as we're talking about it, the stress of the healthcare team. And then we also hear about nursing shortages, how that might be impacting care, and then what plans are underway to obtain and retain healthcare workers. I can tell you, when I pass by in the afternoons from the Children's Foundation headed out on Woodrow Wilson, and I look to the left and see those tent hospitals in the parking garage, it's like, I mean, it's very sobering. And then, I just feel very helpless in so many ways, because I'm on the outside, and then what you're doing is on the inside, and your whole team of folks there. So how is this impacting the work of nurses and the whole healthcare team?
Right. Well, everyone who works in Children's Hospital, and I've always been very proud to say that they all take care of children as if the child is their child. I mean, we have a very, very strong sense of we want to provide care that we would want our own family members to have.
Yes.
So we want to really be giving that quality level of care that we would want for ourselves and for our family and our children. But all aspects of the team are really in a strained position. There's a shortage of nursing. We have many nurses that are coming out of orientation who are in training, and then we've hired, and we're trying to get them, in orientation, but we certainly don't want to put a strain on them by having them out of orientation before they're really prepared to take care of patients. These are young people that are just finishing their training. Same with respiratory care. I think there's a burden on the respiratory therapist, because every one of these children needs respiratory treatments, management of their ventilator, management of their non-invasive ventilation. All of those things take intensive care by the respiratory therapist, and that they're kind of the unsung heroes also, because that's a whole group of people that are really, hands-on countless hours taking care of these children with respiratory problems. We have a team of specialists that are called ECMO specialists. That's a special kind of care for the extremely ill people. But those typically have been in the adult population, and so far we've had them in the adult population. We've had one child, I believe, that was on ECMO, but that's a kind of a very, very intensive management, but it's managed by our pediatric respiratory and nursing teams. So all of those things kind of impact our team. You've probably heard in the news about people going traveling for nursing. Other places around us have enticed nurses to go to be travel nurses, and they pay an exorbitant, a large amount of money for people to go travel elsewhere when we need them right here at home. So that kind of puts a little bit of pressure on our system as well. So the team and the morale can get kind of low at times, but I think they do. Everyone here really rallies and tries to bolster each other. We have people in our community have been very, very supportive, and bringing some food for the nursing staff and those types of things that really kind of helps their morale. But again, people will do whatever it takes to take good care of children, and they do go above and beyond. But there's just so much, before people get fatigued with that process. So we're working hard to come up with ways that we can be supportive of each other. I will say that every level of the hospital has really stepped up. I mentioned the boarders in the emergency room. So those practitioners, be it nurse practitioners and faculty, their job is not typically to maintain people there for hours on end. Their job is to keep them in the first hour and get them turned around and settled, and then disposition somewhere else in the hospital. So when they have to board patients there, that's not their usual workflow, but they've stepped up and done it. And there have even been people who've stayed there for days, waiting for a bed. They've been there for 3 or 4 days waiting for a bed. And so they have to, treat them as though they were in the hospital. So that, they've stepped up. People on the floor have stepped up and done some respiratory care things that we typically wouldn't do on the floor, but we have our ICU team kind of co-managing on the floor in that regard. So everyone's kind of stepped up and done the right thing and continue to do so, but it definitely is a challenge.
Well, and these are very young children, and then these are children who are school age as well. When we start looking at some of the bar charts and graphs that are out there, and it clearly has increased since school has started, from when you look at those dates. And so we know that for children under 12, there is no vaccine that's been approved that's available. But for children 12 and older who are eligible for the vaccine, I'm wondering about, of the children that you were seeing in the hospital who are eligible, how many have had the vaccine? We know in adults, we see those statistics that very few who are hospitalized or in ICU are the worst outcome, death. The percentage is very much that happens when individuals have not had the vaccines. But for children, what's that looking like with the percentage of children being vaccinated who are eligible?
Well, very few who are in the hospital have been vaccinated. So we see quite a few teenagers, 14, 15, 17, who are not vaccinated, who get quite ill and are in the hospital. And then we've seen infants, babies, toddlers, young children in the hospital, and of course they're not eligible. And those are the vulnerable population that we are really not able to support with the vaccine. But certainly the ones that are eligible, that are in the hospital, I really can't off the top of my head even recall one that was vaccinated that was in the hospital. So the vast majority are not vaccinated. It's common, history that we get that either the family wasn't vaccinated and someone in the family got COVID as a teenager, or we were just about to get vaccinated, or we had been thinking about it but hadn't gone that route yet. So it is a little bit it's just disappointing because we feel like there is a solution and there is something that can help with this. I think there's a little bit of confusion about the vaccination. People have thought, well, it's supposed to prevent you from getting COVID. Not necessarily. The vaccine will prevent you from being deathly ill with COVID or require hospitalization from COVID. So you might still get COVID. You're far less likely if you're vaccinated that you will contract COVID. But if you do, it's very, very unlikely that you will require hospitalization or that you'll get ill, and certainly in adults that you will die. So, it's doing what it's intended to do, to protect us from deathly illness with COVID. So I think, that's been a little bit of an education gap there, that people feel like there's breakthrough cases. It's really not as much the breakthrough cases, that the cases that we're seeing in vaccinated people, they're not that sick. They're not in the hospital.
And another opportunity to protect our children.
That's right.
For children who are 12 and older, and then certainly for children who are not even eligible for the vaccine.
Right.
We also hear a lot about this multi-system inflammatory within children, and you mentioned a whole lot of different viruses earlier on in the discussion, but could you explain a little bit more about the connection between COVID and the multi-system inflammatory?
Sure. The acronym is MIS-C, MIS-C. It's multi-inflammatory system in children. And you have the same kind of thing in adults, but it's far more common in children. So children who have COVID-19 can get an inflammatory response that basically attacks the heart muscle and makes the heart weaken. So they get inflammation of the heart muscle. It's very much like there's an illness called Kawasaki disease that happens in children. It's in the 5-year-old to 12-year-old kind of range of children. It's very, very similar to that, where the coronary arteries can be affected, the heart muscle can be affected. In children with MIS-C, in January, when we saw a few cases of this in Mississippi, the children all of them recovered. They did very, quite well with it. They do require follow-up care in an outpatient setting. They do require, multidisciplinary care with multiple different providers and specialists. We have seen a surge in that here in the hospital with this Delta variant. We've had, 5 to 7 patients at a time in the hospital with this inflammatory condition. And oftentimes it's kind of delayed from the respiratory part that you have. So you might be diagnosed with COVID at one point in time, and 2 weeks, 3 weeks later, you have this
Oh,
MIS-C kind of reaction. It's kind of a lingering effect of having had COVID. So, it definitely can be, a serious illness. We've had recently, people in the intensive care unit, yes, requiring medicines to help support the heart until they kind of get past the inflammatory reaction. But it is more common in children than in adults.
so it just sounds like there are multiple stressors, physical stressors when this is happening, but I'm also wondering about the emotional, and we talked about the stress of the healthcare team there, but what about the emotional impact that you're seeing that it's having on children and families who were there with these children?
Yeah, it's definitely an impact. When your child has COVID, first of all, everyone's fearful because this is a novel thing to our society. We don't know a lot about it in the scheme of medicine. It's not something that's been around a long time. People are fearful of what could happen. They're fearful of these things like the MIS-C diagnosis. They're fearful of deterioration or long-term lung problems, all those types of things. And then they themselves could contract COVID, and most people have aunts, uncles, grandparents, other, family members they're concerned about. Many of them have children at home. And so this idea of the isolation of one child and then the other children are at home without their parent. I mean, it's just
Multiple demands. Yes.
Demands. It's very complicated. So having one child, recently I've had a patient where an infant child was in the hospital, not with COVID, but siblings at home with COVID. So then how does the mom isolate, not able to come visit the child that's in the hospital? It's just a very complicated stresses on the family that they wouldn't normally have. So I think as much as we can do, we should do, with the vaccination and vaccinating children who are eligible, vaccinating teenagers and adults who are eligible would really tamper down the incidents in the community that would put everybody at risk. Those people, the elderly, and certainly the young children who are not eligible yet.
You are really painting a picture that I am sad that we're in the situation that you are painting this picture, but I think it does help elevate the concerns and the challenges that you see there. Changing just a little back to the adult population and some things that we've heard about with COVID, and I'm wondering how this also might impact the children, because in the adult population at the beginning of COVID last year, and now we're hearing it again with the surge, that there's some elective surgeries as well as some routine procedures that are being delayed as a result of hospital bed. I'm just wondering how this might hold true for pediatric hospitalizations or some care that may not be as urgent, but how is this impacting the emergency department? And things come up. We know with young children and children of all sorts. We talked earlier about school starting back, and we know about Friday night football games, and people get hurt or have injuries. So how is this impacting children of Mississippi?
Well, that's a great question. In adults, they have been able to postpone some elective procedures. In children, it's just not that easy to do, quite honestly. I mean, most things that children require surgery for, they really need it. If they don't need it today, they need it this month. And we don't think things are going to be much better a month from now than they are right now. So having not being able to see the end in sight, it's hard to postpone things, because if we don't do it this week, we try to do it next week. Well, next week's not going to be that much different than this week, and it's going to just create this big backlog. So we have a little bit difficulty determining, unless something is just purely a cosmetic, superficial procedure. Most things are still necessary to be done, and waiting will cause some other impact that there's a negative impact. So we don't really have the luxury of postponing things too terribly much in children. during this surge, we've been meeting, kind of circling back to the strain on the system, we've been meeting as a team every single morning and reviewing the surgery cases for that day and the next to try to determine, is there any movement that we can do? Is there anything we can postpone? Primarily around things that require intensive care unit monitoring, because there are some surgeries that we do in children, of course, like a heart surgery, for example, they have to be in the intensive care unit. Certain types of brain surgery, obviously, you would have to be in the intensive care unit. So if you know you're going to require an ICU bed, and those are, short, we have a shortage of those based on the nursing and our capacity. We just have to kind of make sure that we preserve a bed for that person, and that this is the day that they need to have. They can't be done another day, and just really, it's a lot of just careful, screening and sorting through those things to make sure that we're always doing the safest thing. We want all the patients to get the very best care that they can get, but we want to make sure we're doing it in a timely way, but yet attentive to the fact what our resources are on that day. So it's a delicate dance, basically.
Again, because you only have so many staff, you only have so many beds, et cetera. So we've talked
we have
about
to be kind of ready for emergencies. You mentioned emergencies. We have to be prepared that there are emergencies. As you said, Friday night football, you can have accidents and injuries and things that we have to take care of in the moment. So we kind of have to have that in the back of our minds and a reserve for that also. So it's kind of forced us to kind of, obviously we put our heads together and try to come up with the very best plan for day by day, but it is a minute to minute, day to day kind of planning.
Yeah. So we've talked about a lot of concerns so far. What would you say your biggest concern or two are at this point?
Really is the ICU level care, and escalating our care and kind of pressing ourselves to do more in these different locations. That puts a strain on our system, and we want our staff to be to feel good about when they come to work and feel good when they go home, because we want them to have a long time here with us. We want to maintain all of our staff, and we have had a little bit of impact of our staff getting ill too. I mean, that kind of complicates things a bit when they have to be out on isolation, or if they have a family member they're exposed to, for example. So I think the main thing is just the stress and strain on the system, as we've been talking about. There are options now. Thankfully, we're very, very blessed that there is a vaccine. There is a safe vaccination. It has gotten FDA approved. It is approved for children 15 and over. It is on an emergency use authorization for down to 12 years of age. And it's a very safe and effective vaccination. So that's the very, very positive part. Now it's spreading the education with things like this that we're doing today to kind of help people understand that it is safe, it is effective, and we can do something about it. And it is in our power to do that. And I think for those that are not able to get the vaccination, and certainly even those of us who are vaccinated, to wear a mask. It's not anybody's favorite thing to do, certainly, but it's an easy thing to do, and it works. We saw it work when we started wearing masks in January, and back when COVID first started, even last year. And I think until we get a broad part of the population vaccinated, wearing the mask is the best way to prevent that, inadvertent spread. And in schools, for children over the age of 2, the American Academy of Pediatrics recommends them wearing masks, and keeping social distancing and hand hygiene and all of those things. And those are things that, are pretty straightforward and easy to do, and will hopefully add a little bit of layer of support for protection for those children who are vulnerable.
And based upon numerous studies.
That's right.
And you said the American Academy of Pediatrics is not going to come out with a policy recommendation without it being backed up by numerous scientific studies. So again, the things that we can do of of individuals who are outside of the hospital, but who care about children and care very deeply about children. So I think maybe you've already said some of this, but are there any other messages that you would have to parents or grandparents of young children to really prevent their children from ending up, not only in the hospital, but the ICU?
Well, I think, for everyone eligible to get the vaccination, it's free, it's readily available, it's approved for all the adults in your household to be vaccinated, and to teach your children these practices like wearing a mask. We have to demonstrate that so that they see that it's something that can be done and should be done. I think children are going to follow your lead. So I think showing your children that you're wearing a mask when you're in public or when you're in a group setting and those types of things, I think those are all things that are very, very helpful, and encouraging them to wear a mask at schools, even if the school doesn't have a mandate to do so. Instructing them and talking to them about the importance and why it's important, and that you're helping other people by doing that. You're helping your grandmother or whomever, may not be vaccinated. So, kind of sending that message, I think, is something we can all do. Talking to some people in other states recently, I go on a medical mission trip every year to Africa, and we were supposed to leave in November, and of course we postponed it.
I was going to say something about that introduction, and then I went on to the questions. I knew you went.
I go actually with Samaritan's Purse, and so I convened the group with Samaritan's Purse to say, well, Samaritan's Purse is right here. I feel really funny about taking a team from here and driving past our Samaritan's Purse people to go to Africa. So we're going to need to postpone. So we postponed it. But some of the members of our team, we have someone in Canada, we have some people at Mayo, we have some people, in Maine. They're not seeing this. I mean, they were kind of shocked because the guy at Mayo said, well, we have an 80% vaccination rate. He said, we don't have anybody in the hospital with COVID. And the guy in Canada said, well, everybody's vaccinated. He said, I think we may have one patient last week. So it was just so different, the experience. And even someone in Cincinnati who said they have very, very little because the population is all vaccinated.
So are these colleagues who would have come with you, are they going to come to Jackson now?
They were supposed to have come with us to Kenya. Like, well, come here,
Yeah, right.
Taking the time off, we'll take it. But, it's so disheartening that there's an answer, and we're just not taking advantage of it and doing the right thing, and here, the proof is right here in this country. Just look at the states that are vaccinated and their rates, and it's so much better.
Yeah.
And, I think also people have a little bit of a feeling that this causes a cold or sniffles in children. That's what we've heard. It's just not true.
Right.
It might cause cold and sniffles in some children, but not in all children. And there are children who've gotten deathly ill and children who have died. So I think it's very impactful to children. I think people, assume it's not going to be, because most children are resilient, but not all of them. So we just really have to be careful about making sure people know that it is a serious thing and we need to take care of them.
Thank you so much, Dr. Taylor. When we think about, I obviously it's been a long time since I have been a child, obviously. And I remember it was not, we didn't have seatbelts. We didn't wear seatbelts early on within a vehicle. And as time has gone on and people know how lives were changed and were saved, and even if there was an accident and some injury, it was still better than the alternative of going out the windshield. And so now when you think about the car safety seats, and that's just something that you automatically do. There's beeps that go off. Yeah, there's beeps that go off in your vehicle if you don't have your seatbelt on. And so I think about it is different, but it is still, when you think about what we could do to protect children and protect other people. So you've said it very well. Thank you. There's just no way that I can express The thanks to you and the entire medical team at the University of Mississippi Medical Center and all across the state, whether it's in a rural clinic or various hospitals, other areas. Thank you from the bottom of our hearts for the things that you're doing to keep our children safe.
Thank you. Thank you for spreading the word and helping us take the best care of children.
Thank you.